Shingles and the shingles vaccine. What everyone needs to know. Part 2. Shingrix the shingles vaccine. And does the vaccine delay dementia? In part 1 of this series, we talked all about the disease of shingles. Today, in part 2, we will go over everything you need to know about the shingles vaccine. And as a bonus, we will discuss its role in delaying dementia. Let's take a moment to review some important facts about shingles. Shingles is a viral infection that causes a painful, blistering skin rash. It is also called herpes zoster because it is caused by the varicella zoster virus. This is the same virus that causes chickenpox. The recombinant shingles or zoster vaccine, called Shingrix, can prevent shingles by helping the body create a strong defense against the virus. By preventing shingles, the shingles vaccine also protects against the most common complication from shingles, called postherpetic neuralgia or PHN. The risk of shingles sharply increases after the age of 50 as the immune system naturally weakens. Patients with weakened immune systems are also at high risk. For the sake of convenience, throughout this presentation, I will be referring to the recombinant zoster shingles vaccine as its product trade name, Shingrix. Here is an interesting key point. According to a 2022 Government Accountability Office report, only about 30% of adults who are eligible for the shingles vaccine have received it. Who should get the shingles vaccine? The CDC recommends that adults 50 years and older with healthy immune systems should receive the shingles vaccine. In this group, vaccination is over 90% effective at preventing shingles and postherpetic neuralgia. The CDC also recommends that adults 18 years and older who have weakened immune systems are at a higher risk for complications, so they should also be vaccinated. These include patients with medical conditions that keep the immune system from working properly, such as certain cancers like leukemia and lymphoma, and HIV infection. Patients taking drugs that alter the immune system, such as steroids and drugs given after an organ transplant. There is no maximum age for getting Shingrix, and Shingrix is not used to prevent primary varicella infection or chickenpox. The patient should still get Shingrix even if in the past they had shingles. If they had shingles in the past, Shingrix can help prevent future occurrences of the disease. There's no specific length of time that the patient needs to wait after having shingles before they can receive Shingrix, but generally they should make sure the shingles rash has gone away before getting vaccinated. Also, the patient should still get Shingrix even if in the past they received Zostavax. A live virus shingles vaccine called Zoster Vaccine Live or Zostavax is no longer available for use in the United States as of November 2020. If the patient had Zostavax in the past, they should still get Shingrix. And the patient should still get Shingrix even if in the past they received varicella or chickenpox vaccine. Can you get shingles more than one time? People who have had shingles in the past are recommended to get the shingles vaccine. Most people who develop shingles have it only one time. However, it is possible to have shingles more than once. Studies have shown that about 6% of people will get shingles more than once, with a range of 1.2 to 9.6%. There also may be an additional benefit of receiving Shingrix, which will be described later. Chickenpox. You can get Shingrix whether or not you remember having had chickenpox in the past. More than 99% of Americans born on or before 1980 have had chickenpox, even if they don't remember having the disease. Adults with weakened immune systems and no documented history of chickenpox disease, chickenpox vaccination, or shingles should talk to their healthcare provider, who can refer to the CDC recommendations for further guidance. Let's move on and talk about the dose. The shingles vaccine is given as a 2-dose series. 2 doses of Shingrix, each 0.5 ml, should be given intramuscularly in the deltoid region of the upper arm 2 to 6 months apart. For most people, the second dose should be given 2 to 6 months after the first dose. However, some people who have or will have a weakened immune system can get the second dose 1 to 2 months after the first dose. Adults 50 years and older should receive 2 doses separated by 2 to 6 months. If more than 6 months elapsed since the first dose, administer the second dose as soon as possible. Do not restart the vaccine series. Adults 18 years and older with weakened immune systems due to disease or therapy should receive 2 doses. If needed, they can get the second dose 1 to 2 months after the first dose. The shingles vaccine may be given at the same time as other vaccines. Shingrix brand is the only shingles vaccine currently approved by the FDA. Shingrix has been FDA approved and available since 2017. Shingrix is manufactured by GlaxoSmithKline or GSK. Shingrix is not a live virus vaccine. It is a recombinant vaccine. A recombinant vaccine is where manufacturers take a small piece of DNA from the pathogen and inserts it into bacterial or yeast cells, which then produce its proteins. These purified DNA proteins then trigger an immune response in the body to fight the virus. Shingrix does not contain thimerosal and does not contain any other preservatives. Reconstitution. Shingrix is supplied in 2 vials that must be combined prior to administration. Prepare Shingrix by reconstituting the lyophilized varicella zoster virus glycoprotein E antigen component, the powder, with the accompanying liquid adjuvant suspension component. A single dose after reconstitution is 0.5 ml. Here is a diagram on how to reconstitute the shingles vaccine vials. The liquid component is first removed from vial 1, then transferred into vial number 2. Gently swirl the vial until the powder is completely dissolved. Remove 0.5 ml of the reconstituted vaccine and administer intramuscularly. Storage and stability. Before reconstitution, vials should be stored refrigerated between 2 degrees centigrade and 8 degrees centigrade, 36 degrees Fahrenheit and 46 degrees Fahrenheit, and protected from light. Do not freeze. After reconstitution, use immediately or store refrigerated between 2 degrees centigrade and 8 degrees centigrade. Discard if not used within 6 hours of reconstitution. Efficacy. How well does Shingrix work? 2 doses of Shingrix provide strong protection against shingles and postherpetic neuralgia, or PHN, the most common complication of shingles. For adults 50 to 69 years old with healthy immune systems, Shingrix is 97% effective in preventing shingles and 91% effective in preventing PHN. For adults 70 years and older with healthy immune systems, Shingrix is 91% effective in preventing shingles and 89% effective in preventing PHN. For adults with weakened immune systems, Shingrix is between 68 and 91% effective in preventing shingles, depending on the underlying immunocompromising condition. In adults 70 years and older with healthy immune systems, Shingrix immunity remained high throughout 7 years following vaccination. Despite these benefits, only about 30% of adults who are eligible for the shingles vaccine have received it. Side effects. Studies show that Shingrix is safe. Shingrix causes a strong response in a person's immune system. The vaccine helps the body create a strong defense against shingles. As a result, the vaccine may produce temporary side effects. These side effects can be uncomfortable, but they usually go away on their own in about 2 or 3 days. Some people who got Shingrix experienced side effects that affected their ability to do regular daily activities for a few days. Here's a table of 5 side effects of the shingles vaccine. A sore arm with mild or moderate pain is very common after the shingles vaccine. Redness, itching, and swelling can also happen at the site of the injection. Injection site pain occurs at a rate of about 78%. Tiredness, muscle pain, headache, shivering, fever, stomach pain, and nausea are common after the shingles vaccine. Myalgia and fatigue occur at a rate of about 45%, headache 38%, shivering 27%, fever 21%, and gastrointestinal symptoms 17%. Syncope or fainting can be associated with the administration of injectable vaccines. Notify your provider if you feel dizzy or have vision changes or ringing in the ears. Guillain-Barré syndrome, a serious nervous system disorder, has been reported very rarely after Shingrix or having shingles. The earliest symptoms usually involve tingling or numbness in the fingers or toes, which may lead to severe muscle weakness. Severe allergic reactions are very rare. Signs of a severe allergic reaction can happen within minutes or hours after vaccination. Signs include hives, swelling of the face and throat, difficulty breathing, a fast heartbeat, dizziness, or weakness. If you experience these or any other life-threatening symptoms, call 911. This slide reviews the Shingrix side effects. Side effects were more common in younger people. Side effects can occur with the first or second dose of Shingrix or both doses. Even if a person had mild to moderate side effects after the first dose, they should still get the second dose of the shingles vaccine. Taking an over-the-counter pain medicine, such as ibuprofen or acetaminophen, after getting Shingrix can help ease discomfort from side effects. How do you pay for Shingrix? There are several ways shingles vaccine may be paid for. For Medicare patients, starting in 2023, people with Medicare Part D coverage will pay nothing out of pocket for the Shingrix vaccine. For Medicaid patients, coverage varies state by state. Medicaid likely covers Shingrix for patients 50 years and older in more than 2/3 of states, those that expanded Medicaid under the Affordable Care Act. Private health insurance. Many private health insurance plans will cover the vaccine, with usually no out-of-pocket costs. Vaccine assistance programs. Some pharmaceutical companies provide vaccines to eligible adults who cannot afford them. Check with the GlaxoSmithKline website. Now let's move on and discuss the role of the shingles vaccine in preventing dementia. The shingles vaccine, does it delay the onset of dementia? There is growing evidence from recent studies that the shingles vaccine is linked to a lower dementia risk. Getting the recombinant version of the shingles vaccine, called Shingrix, is associated with a significant delay or possibly even preventing the onset of a dementia diagnosis in older adults. To study this hypothesis, 3 studies looked back over the medical records of hundreds of thousands of people who were vaccinated with Shingrix and compared how frequently they were diagnosed with dementia versus people who got other kinds of vaccines or no vaccine at all. We will go in depth into each of these 3 studies. The most recent study that showed the benefit of shingles vaccine in reducing the risk of dementia was performed at the University of Oxford in the United Kingdom and published in the journal Nature Medicine in July of 2024. Takei and his colleagues wanted to know if the newer recombinant shingles vaccine Shingrix was associated with a reduced risk of dementia compared to an earlier live virus shingles vaccine named Zostavax. Researchers studied electronic medical records of more than 200,000 Americans over the age of 65. In October of 2017, there was a switchover from use of the live vaccine Zostavax to the recombinant vaccine Shingrix in the United States. Zostavax was eventually discontinued in 2020. They looked at the incidence of dementia diagnoses in more than 100,000 adults over 65 who got the Zostavax vaccine prior to 2017 and compared them with about 100,000 adults who got the Shingrix vaccine. The average age was 71 years old. Results showed that within 6 years after vaccination, Shingrix was associated with a delay in the diagnosis of dementia compared to Zostavax. Receiving Shingrix was associated with a 17% lower chance of being diagnosed with dementia, translating to 164 additional diagnosis-free days lived without a diagnosis of dementia in people who were eventually affected, or a delay in dementia diagnosis of about 5 months over time. The findings also found that the beneficial effects were greater in women than in men. Women who received Shingrix had a 22% lower risk of developing dementia within the next 6 years compared to women who got Zostavax, while men had about a 13% lower risk. Both sexes had a similar rate of developing shingles. As an additional control, the researchers looked for lower risk of dementia in seniors receiving Shingrix compared to 2 other vaccines commonly used in older adults, influenza vaccine and Tdap vaccine. The risk of dementia in those who got a Shingrix shot was 23% lower than in people who got a flu shot and 28% lower in people who got a Tdap vaccine. Assessment. People who were vaccinated didn't avoid dementia completely, but it did seem to be associated with a delayed diagnosis. By the end of the 6-year follow-up period, the total number of dementia cases were similar in the 2 shingles vaccine groups, but there was a difference in the time at which they received the diagnosis of dementia. This suggests that rather than actually reducing dementia risk, Shingrix delays the onset of dementia compared to Zostavax in patients who go on to develop the condition. This research was not funded by GSK. However, one of the study authors, an immunologist, was a paid consultant for GlaxoSmithKline, or GSK, the company that makes the Shingrix vaccine. The second study was performed by GSK. Another study, named Zoster 122, was presented by the drug manufacturer GlaxoSmithKline at the Alzheimer's Association International Conference in Philadelphia in July of 2024. This was a retrospective observational matched cohort study in adults aged 50 years and over. The study examined the potential association between Shingrix and reduced risk of dementia compared to 2 other elective vaccines, Zostavax and Pneumovax 23. A large database of electronic health records of nearly 600,000 people across the United States was mined by researchers. They used a similar approach to the Oxford study. The data compared the diagnosis of dementia in people who were vaccinated against shingles with either the older Zostavax vaccine or the newer Shingrix vaccine against people who were vaccinated with Pneumovax. The study results showed that patients who were vaccinated against shingles were less likely to be diagnosed with dementia than those who got only the Pneumovax vaccine after 3 to 5 years. After 3 years, people who got Shingrix were 24% less likely to have dementia than those who only got the Pneumovax vaccine. People who got Zostavax were 8% likely to be diagnosed with dementia compared to people who got only a Pneumovax vaccine. When the two shingles vaccines were compared to each other, Shingrix was associated with a larger degree of benefit than Zostavax. People who got the Shingrix vaccine were about 23% less likely after 5 years to have a diagnosis of dementia compared with people who got Zostavax. GSK, who makes the Shingrix vaccine, funded, sponsored, performed the research, and presented its findings. As of yet, the full study has not been peer-reviewed by outside experts or published in a medical journal. The Wales study. Another study showing the link between shingles vaccination and dementia was published last year in the journal Alzheimer's and Dementia in December of 2023. The research was conducted by Marcus Eiting and his colleagues at Stanford University. Their study used medical records from more than 280,000 people in Wales to assess the incidence of dementia in those who did and did not receive the shingles vaccine Zostavax. Results. Researchers found that those who received a Zostavax vaccine benefited from a reduction in the probability of a new dementia diagnosis over a follow-up period of 7 years by 3.5 percentage points, corresponding to a 22.4% relative decrease. They found that the effects were particularly stronger among women than in men. This study is not yet peer-reviewed. Possible reasons for benefit. The reasons for the risk reduction are unclear, although it is possible that the shingles virus itself may play a role in the development of and contribute to some types of dementia. The virus that causes shingles and chickenpox is present in nerve cells and can cause inflammation that could contribute to neurodegeneration. So the vaccine that effectively protects against shingles infections might also decrease the chances of developing dementia. Furthermore, there seems to be something about the particular way Shingrix stimulates the body's immune system against shingles that decreases the chances of dementia. There is a specific immune response that might be triggered by this Shingrix vaccine, and that may also lower the risk for dementia and memory problems. The results could also mean that vaccines in general give the body an overall protective effect rather than specific protection from shingles reducing the dementia risk. Vaccines may be able to modulate the immune system, providing an overall immune boost later in life and reducing overall inflammation. Limitations. It is important to note that the study findings suggest that the shingles vaccine could delay dementia, not necessarily prevent the disease. However, a 5-month delay in dementia diagnoses is significant and may have major public health implications. Even though the studies were thorough and well carried out, it is based on medical records that do not provide other important information, such as people's physical activities, diets, smoking, high blood pressure, and excessive alcohol consumption. There are other factors that have definitely been linked to an increased dementia risk, and controlling those can make a difference in brain health. Summary. In Part 2, we outline who should receive the shingles vaccine, define the shingles vaccine dose, describe the efficacy, side effects, and availability of the shingles vaccine, and summarize the 3 studies that investigated the role of the shingles vaccine in preventing dementia. We've got a lot in store at the Farm Easy Tutor channel. There will be upcoming talks on RSV vaccine for adults, electrolyte management, atrial fibrillation treatment, drug overdose, and much, much more. So please stay tuned to us. Thanks for tuning in to watch this installment of the Farm Easy Tutor. I hope you learned something that you could use at school or in practice. If you would like to continue to see more of these types of tutorials on YouTube, please make sure to click on the black subscribe button below to change it to the word subscribed. Also, if you like this video, I would appreciate it if you can click on the thumbs up icon below to change the color to black. Also, if you have any comments or questions, please feel free to add them in the comments section below or share this site with someone else. Stay tuned to the Farm Easy Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.